Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome again to week 3 of discussions on the WHI study that scared all women and doctors of estrogen. This episode, as promised, is all about the breast cancer risk and how this study scared all women from using estrogen. This is the major argument most doctors have when they tell women not to use estrogen after menopause. It's the breast cancer scare, is what your best intended friends, your family and colleagues might use to protect you from breast cancer, to protect you from estrogen. They will tell you, do not use estrogen, it's going to give you cancer. So I want to dig more into the outcome of the critical WHI study that impacted and continues to impact so many women today, 2 decades later. Let me address the risk of breast cancer, as it was the only thing everyone talked about after the study. Nobody really focused on the cardiovascular outcomes. Nobody was excited about that except for cardiologists who are like, okay, well, we can't use this pill to protect women. Bye-bye. They were done, right? But then the menopausal hormone therapy took a hit after this study. Let me explain why estrogen became public enemy number 1. As I explained before, the WHI study had 2 arms. Each hormone therapy had its own arm, one for Premarin, which was estrogen only, and one for Primpro, estrogen and progestin. The controlled placebo group was for both of these studies. So the Premarin has its own controlled placebo group, and the Primpro had its own controlled placebo group, right? So the breast cancer incidence in the placebo group for women who had not received any form of estrogen, but who believed that they might have received estrogen with progestin. So let's take Primpro first. The incidence of cancer was 30 cases for 10,000 women. That's 3 for each 1,000 women. There were 3 breast cancer cases for each 1,000 women in the placebo group who received no hormones, and was the control group for the Primpro group. The incidence of breast cancer in the estrogen plus progestin group, that was Premarin and progestin, so that was the Primpro group, who received the hormone therapy but did not know what they received. Again, it was double-blinded. The incidence of breast cancer in this group was 38 cases for every 10,000 women, or 4 cases for each 1,000 women. So there was 1 more case of cancer for each 1,000 women. There's a 0.1% increased risk. So in terms of statistical analysis, this increase from 30 cases per 10,000 to 38 cases per 10,000 came up to be a 26% increase in breast cancer risk. Even though absolute risk was very small, a very small increase in an absolute increase that will translate into a large increase in relative percentage risk. So let me put this into perspective. Without any hormone therapy, the incidence of breast cancer in women at the age of 75, it's about 4 in 1,000. These are women who have never taken estrogen. Consider that at age 45 to 50, 30 years prior, the incidence of breast cancer is 2 in 1,000 women. So your risk as a woman who will never take estrogen, if you decide this is the path that you want to take and you never take an estrogen, your risk will double, will go up 100% if you use 0 estrogen. If you never put estrogen in your body, your risk of breast cancer will go up by 100% from age 45 to age 75. So with this Primpro medication, the risk went up 26%. So, but in absolute numbers, there was one more case for each 1,000 women. Now, that's not an increased risk. That's really not, in the perspective and the big scheme of things, a 0.3% risk going to 0.38% risk. Talk to any risk assessment analysis person. They'll tell you, oh yeah, you probably do procedures in your life that are more invasive. Like, I remember I had to go to the ER because I was dehydrated, and the doctor thought maybe I was having a stroke, even though I was about to pass out, and I didn't. So they wanted to do this test where they injected microspherules of air, micromolecules that were micronized, into my vein to go through my heart to see if I have a hole in my heart that could explain maybe why I had a TIA, a transient ischemic attack. Turns out I didn't. I was just dehydrated and the test was negative. But I asked, hey, what's my chance of having a stroke with this? And they said, yeah, it's less than 1%. I'm like, 1%? That's 1 in 100. I don't want to take any percent. I want to take 0%, right? When it comes to having a stroke. So when you put that into perspective, we do things in our life that carry much more than this increased risk. Now, here's the thing. No doctor who has a busy office schedule will have the time to explain to their patient these facts, these numbers. No one is going to go over the findings of the study in such detailed terms as I'm outlining them to you here. We had 30 cases for 10,000 women. That's 0.3%. And with the hormone medication in that study, which is a hormone medication we no longer use today, 38 cases in 10,000 women were found, which means the 0.3% risk went up to 0.38%. Let's call it 0.4%. That's a 0.1% increase. That's nothing. Let me put this into another perspective. The risk of dying from sepsis induced from a urinary tract infection in an older woman varies from 12 to 50%. It is higher as the woman is older. Consider the fact that estrogen could potentially protect a woman from UTIs and save her life. And put into perspective the 0.4% risk of breast cancer compared to 0.3% risk of breast cancer if she never uses estrogen. Now, would you hesitate and worry about this minimally increased risk if you knew that estrogen could save your life by preventing a deadly sepsis from a recurrent UTI as you get older? No, you wouldn't hesitate. Let's look at this from a different perspective. The risk of dying after 1 year from a major hip fracture from a postmenopausal woman is around 30%. So basically, if a woman breaks her hip, her risk of dying a year from her hip fracture is 30%. Now, should she have used estrogen for 2 or 3 decades prior to the hip fracture, she would have had good bone density. She probably would have never broken a hip. So estrogen could save a woman's life by preventing fatal fractures caused by osteoporosis. Again, put that into the perspective at the 0.1% increased risk of breast cancer if you use that specific hormone, which again was not good, and we don't use that hormone anymore. Let's talk about dementia. The risk of dementia as a woman ages increases as she gets older, just like the risk of breast cancer does, independent and without any estrogen use. We get older, our brain gets older, we have more risk of dementia. A woman's lifetime breast cancer risk, by the time she reaches 80, it's about 12%. A woman's dementia risk by the time she reaches 80 could be as high as 20% and as high as 30% by the age of 90. So you're more likely to get dementia than you are to get breast cancer. What if women that are at risk for dementia were to use estrogen from the age of 50 all the way until 80 and beyond? And what if estrogen would protect them from dementia? Where is that study? That's what we should be looking at. Now, we don't have that study yet, or if we do, we definitely not have it on the scale of the WHI study because nobody's investing money in women's wellness. I talked about that in a couple of episodes. Now, let me go back to the risk of breast cancer because that's what everyone was focused on when they talked about estrogen. And it is all originating based on the findings of this study, which was released 20 years ago. this WHI study. Again, this study was very important and pivotal in many aspects, even though its findings were twisted to shape public opinion of estrogen in what it is today and what it has been for the past 20 years. And that's what many doctors are somewhat angry about, because that's not fair to estrogen. So I was explaining that women who use estrogen, specifically horse estrogen in the form of a pill combined with progestin, have a slightly increased risk, right? I said that multiple times, 0.3 to 0.4. Now, let me make you aware that there was a second arm to this study, an arm that used Premarin only, no progestin. That arm was composed and enrolled women that had a hysterectomy. These women did not need progestin. They only received the synthetic Premarin, the horse hormone urine in the form of a pill, no progestin. This arm of the study also included about 10,000 women. What is not talked about, but it should be, this should have made news. This should have been very important to highlight, is the fact that, guess what? The breast cancer risk was lower in this group. Yes, indeed. The incidence of cancer was 7 cases less for every 10,000 women. The actual breast cancer risk was 0.23% compared to the 0.3% of the placebo group. What? How is this true? Is this true, really? Yes, it is. Using estrogen only, even a bad estrogen, maybe because there's no such thing as bad estrogen. I keep saying that. So using estrogen without progestin decreased the risk of cancer. Estrogen alone decreased the risk of breast cancer. Stop me right here and repeat me a few times. Rewind, go forward, rewind, go forward. Estrogen decreased breast cancer risk. That's what we should have screamed from the rooftops. This is the truth, and this is what women should know and should have been told, but instead they are not. It is true, many were surprised, considering the previous facts of what I just told you, that estrogen with the progestin increased risk of breast cancer by 26%. So wouldn't you, as a regular layman person, use your common sense and logic and say, hey, wait a minute. So estrogen was really good in this group and it didn't cause any problem. But now we put progestin in the mix and it causes breast cancer? Hello? Who is the culprit here? Progestin. So why is estrogen to blame when clearly the synthetic progestin, which by the way was medroxyprogesterone acetate, that was the culprit? That was what we should have talked about. That was what the news should have been about. Hey guys, these progestins are really not safe and they can increase your risk of breast cancer. Estrogen took the blame for some reason. I don't know, maybe somebody got scared that women were living too long and they were having too beautiful lives and they needed to just yank the rug from under them. I don't know. But estrogen took the axe. And instead of the dark and the naked truth being shouted from the rooftops, hey, progestin use is not safe. And whenever possible, combine estrogen with progesterone instead. But again, we didn't have that at the time. That's what we should have been telling doctors and women alike. But guess what? Progestin is in every single birth control pill. What would be the implications if this would be shouted from the rooftops? Probably nobody would be on the pill anymore. Now, in my mind, if I was in charge, as soon as this study was released, I would have immediately commandeered a study that would have looked at the combination of oral estradiol and oral progesterone versus progestin. Obviously, there are ethical considerations to continuing to use progestin because now we already have a study that says breast cancer risk is increased, clotting risk is tremendously increased. So we can't compare, but you don't need to compare. Just take estrogen, progesterone, enroll 10,000 women. We have the ability to do that now and look and analyze the data because there are products on the market being prescribed today that are available to do this study. We have oral estradiol, we have oral micronized progesterone. We can literally compare apples to apples versus oranges to apples, because if we look at patch and micronized progesterone, that's a whole different ballgame now. Anyway, so what I want you to take away from this is that the black box warning awarded and slapped on estrogen should have really been on the progestins immediately. But again, that means that all birth control sales might decrease. Maybe fertility rates would actually improve. I don't know. Food for thought. I'll come back with a conversation on this topic in the near future. Stay tuned. But let me come back to the hormone therapy. One of my very early podcast episodes in 2023 was entitled Our Body Needs Progesterone, Not Progestin. There are many well-known side effects of progestins. No wonder when compared to the placebo group, the breast cancer risk increased by 26% by adding a progestin. But again, if estrogen alone decreased risk by 26%, then maybe the conclusion of that study should have been progestins should never be used at all for long-term hormone replacement therapy, because hormone therapy is meant to be long-term, and progestins should only be given for a limited amount of time. And even then, if we give it for a few years instead of a few decades, it's not a good safety profile for them. But we give progestins to breastfeeding mothers. It's the only non-estrogen containing birth control pill approved for breastfeeding. We give progestin to young women, and in the case of endometriosis, we use it, right? It's a long-acting progestin called Depo-Provera. It's on the market. It can only be used for 2 years because it can cause significant bone loss, depression, hair loss, and all kinds of things. Consider this. It's a well-known fact that taking a birth control pill increases a woman's risk of breast cancer. Not because of the WHI study. It's just a known risk. Long-term use of birth control pills for 20 or 30 years will increase the risk of breast cancer by 30%, possibly more. Wherever you look, that you're going to find that online. However, immediately goes with saying something like, but as soon as you stop, your risk will come back down to normal. Well, let's talk about this hypothetical situation. A woman who is 50 years old, who has been on birth control pills almost her entire life from the age of 20, except for when she had children and breastfed, decides to transition to hormone replacement therapy in the form of estrogen and progesterone. And she's now 50 and she's been on this therapy for 5 years, and now she's 55. So 5 years into her hormone therapy, she gets diagnosed with breast cancer. No one will be talking about how the 30 plus years of birth control pills increased her risk. Instead, everyone, her oncologist, her breast surgeon, her primary care doctor, her friends, her family, will blame the hormone therapy after menopause. She will be told also that she shouldn't use estrogen for the entire remainder of her life. Otherwise, the cancer could come back. And here's the reality. The truth and the facts are extremely twisted when it comes to estrogen. Numbers do not lie, and the fact that millions of women choose to ignore public opinion and instead make the decision to enrich their lives and improve their health and quality of their lives after menopause by using estrogen speaks of how brave and fearless these women are. It speaks as how in tune they are with their bodies, and it speaks volumes to their intelligence because these women are not afraid to do their research. They're not afraid to ask the questions. They're not afraid to look at the facts, the numbers, and make the best decision for themselves. It sometimes starts by simply taking the decision to partner with an open-minded doctor that's trained and educated in hormone therapy. When you accept hormone therapy from your doctor, you should always ask, please tell me, what kind of training have you received in hormone therapy? Do you have any certifications? Don't just accept the oral pill, even if it has bioidentical estrogen and bioidentical progesterone. Ask why this versus another. Why not the patch? Why not the gel? Why not the pellet? I have women that come to me, and kudos to them, and my hat is off, and I have an enormous respect for them when they come to me and they already have done their research and they ask a ton of questions and they ask me all these, what about this? What about this? What about this? What about this? They already know. They've already done their research. They're committed to getting the best treatment for themselves. These are very brave and fearless women. I was listening to the speeches made at the Charlie Kirk's Memorial in Arizona. He apparently said something like, courage does not require you to be smart. It simply requires you to take action. And that just sunk in. I was formulating the framework of these 3 episodes about the fear around estrogen. And I was just thinking how the women that come to my practice are so fearless. And courage means to take the first step on the path to do what is right for you, what is right for your family, and what is right for the world around you. And some women, most women that decide to do so in the face of all the opposition from their friends and from the public opinion. Because these women decide to do what is right for them, and they decide to listen to me or other doctors like me and take action and improve their lives. And this is the one and only reason this podcast exists, to allow women to be informed in a way, shape, and manner that makes the data interpretation and the complex realities of hormone therapy after menopause easy to understand. So any woman can navigate the labyrinth of hormone therapy very successfully and easily. It's easy to make decisions. When I'm in your ear and I'm telling you all these facts, and you understand after listening to this podcast episode that estrogen is not who you were told. Estrogen, it's an enormously valuable hormone. It's your God-given hormone. And God would not have given you a hormone, or nature, if you believe in the natural law of evolution, you would have not gotten this sexual hormone from the age of 12 until 52 to nourish your body, to turn you into the woman that you have become, to suddenly, when it goes away and you experience the loss in your body, for this hormone to suddenly be the enemy. So you can't have it again. That just doesn't make any sense. If you take all the data about the breast cancer I just presented regarding the WHI study and put it into the perspective of what you know to be true, that this estrogen was your companion for the last 4 decades, from the age of 12 until 52. Again, it will not become your enemy just because you crossed the threshold to 50 and because someone who is misinformed is telling you so. If you understand that, it will be very easy to make brave and fearless decisions and take control of your life after menopause by using estrogen and progesterone, or estrogen, progesterone, and testosterone, or by using testosterone only after menopause. If you consider the fact that estrogen is your gift from nature or from God that helped make you into the woman you are today, then perhaps you will think twice about laying the blame for breast cancer or heart attacks or dementia at estrogen's door. After listening to this podcast episode, I hope you become the confident, well-informed woman that can take on and debate anyone, including an educated physician who pretends to know better and speaks poorly of estrogen therapy after menopause. Many women, even if they're opposed to the idea of estrogen therapy after menopause or hesitate and deliberate forever and procrastinate, deep down, they understand the vital importance of what they lost when they entered menopause. And I want to end this episode on this note. Hormone therapy for menopause and beyond has to be individualized and personalized. And what worked for your friend might not work for you. And what worked for you might not work for your friend. I will come back with more discussion on this topic and why hormone therapy is so difficult to study properly, and why standardization of hormone therapy is really a utopic ideal that modern medicine has to let go of. And each woman will have to understand she is unique in her beliefs, in how the loss of hormone impacts her, and how she responds to different types of hormone therapy. And every woman has her goals and her beliefs and her values. And that is put into the context of her body and her health, her digestive health, her metabolic health, and everything else. And it makes every single woman that walks into the door of a physician a unique case. I sincerely hope this mini-series has shown the light on the dark and naked truth of estrogen defamation, And going forward, please know that estrogen will not give you cancer or kill you by causing a heart attack or stroke, will not increase your risk of dementia, and on the contrary, it will protect you from all these things as long as you understand timing is everything. I'll come back on that topic soon. Please share these episodes with all the women friends you have who have ever told you estrogen is dangerous, so they can, on their terms, now be empowered to be bold and fearless. I honestly value all opinions. Please leave me a comment. Tell me what you liked, what you didn't like about what I had to say. And next week, I'm coming back with the timing of hormone therapy and why it is so crucial that we start early and we not procrastinate. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.